Central by Tracy Rawdan, student at St. Petersburg College. This presentation will introduce and explore the application Wound Central. The importance of wound care information will be discussed first, to emphasize the value of this application. The tools available through Wound Central to navigate outstanding wound care will be described, including the additional resources offered to stay in tune with the best practices with the click of the finger. Estimated that 6.5 million Americans suffer from non-healing wounds. These can lead to morbidity, complications, and mortality. Nurses are a key factor in assessing and caring for wounds, and most wounds are cared for outside of a wound specialist center. Many educational programs do not include in-depth wound education. In addition, the length of clinical experience did not have impact on wound knowledge and application in recent research. Doctors rely on nursing assessment and documentation to provide appropriate treatment plans. This is why we must care for wound care and utilize appropriate resources when providing clinical services. Our Educational Institute offers the application Wound Central to meet the needs of clinicians seeking helpful tools for providing wound care. Nearly every type of wound is identified in detail, with an image library, instructional videos, and reference guides. In addition, links to continuing education and certification opportunities are available. As you can see, the screenshot of the application homepage is located on the right of the screen. The wound care application is simple and to the point, with an easy-to-use technology available for clinicians seeking information during real-time care. The links are organized in alphabetical order and do not have excessive or unnecessary information. One of the links I use most in practice is Wound Info link. Here, a multitude of options to all things wounds display, including assessments, documentations, dressings, tissue types, and treatment plans. Just click on a topic and you will instantly be directed to clinically pertinent tools for wound care. A nurse is required to extract as many clinical cues from a patient using objective, statistical, intuitive, or subjective data. They must interpret that information to form a hypothesis of the etiology and treatment plan. The pictures and videos on this application are the most attractive feature, providing visual aids for comparison and real-time assessments. The pictures are able to be selected with the touch of a finger to zoom in and take a closer look at detail. The videos are primarily offered for treatment and product application, and are narrated to provide further explanation of the procedures. The treatment link offers signs and symptoms to be aware of, treatment plans, and suggested schedules for treatments. Take time to heal and generally abide by a similar natural healing process of inflammation, proliferation, maturation with contraction, remodeling, and increased tensile strength. With that said, accuracy and documentation is critical to identifying a wound's progress. Wound terminology allows for an identifiable, universal language that can assist with proper treatment and prevention of adverse reactions. Wound Central offers quick links to conduct in-depth assessments, identification of types of wounds, and detailed documentation guidelines. These tools include measuring wounds, capillary refill, ankle brachial index, pain assessment, and an overall complete wound assessment guide. Documentation tools include terms to assist with proper directional and anatomical locations, skin layers, exudate types, wound bed and edge descriptions, and an overall documentation guide. In addition to all the usable tools for wound care, the application offers links for continued education, seminars, conferences, and certifications. Specifically, the Wound Care Education Institute presents Wild on Wounds annually to share up-to-date education and training with clinicians. Social media links to Twitter, Facebook, and YouTube are also available to help participants stay connected virtually to wound care topics. Morgan and Donna Sardina, both registered nurses with over 20 years of clinical experience, created Wound Care Education Institute and the application Wound Central. The Wound Care Educational Institute provides all information on the application, and which can be used as an educational provider for the wound care certification and diabetic wound certification and ostomy management specialists. These are board-certified credentials awarded by the National Alliance of Wound Care and Ostomy. The application does not require personal information to access it, nor does it accept responsibility for privacy policies related to connected links of partnering organizations. As a wound care nurse, I utilize this application daily. First of all, it's free. In addition, it is easy to navigate while in the workplace. The pictures available are a great resource, as well as the links to other recognized wound organizations. Some limitations of the application include a small bank of information in some areas. For instance, the products link is very limited and could afford additional information on the many wound care products available. Overall, I highly recommend this application to clinicians working with wounds. In conclusion, the importance of staying current and educated on wound care is vital to assist patients with the psychological, physical, and economic burdens they can experience with wounds. The elderly population is increasing in our healthcare environments, which leads to weaker integrity of skin and slower wound healing. Wound Central is a superb application for iPhone and Android users, as it provides simple and fast access to wound care tools. The pictures and videos are excellent visual aids to enhance knowledge and recognition of wound types and treatments. The simple explanations may seem limited at first, but really are the charm of this application when using it in real-time clinical care of wounds. That's the end of the presentation. Thank you for your attention.